This is Unit 8 on clinical psychology, so it's not any easier, it's just more recent. So that's why I'm doing it here on one of the days when there's a lot of people gone. All right, so when we're identifying what's considered abnormal behavior, we said to consider mainly the 3 Ds: deviant, distressful, and dysfunctional. Remember, deviant means, it doesn't mean it's bad, it means it goes against the norm of what's considered normal behavior. Distressful is that it causes the person and others, like their family, stress, it disturbs them. And then dysfunctional is a big one, is that it is altering or affecting their daily life. A couple others: dangerous and unjustifiable. Those could also fall into the categories. Mental illnesses still follow the medical model and that we want to diagnose. A key word there: etiology. We want to know the cause and history of an illness. And then the prognosis is the forecast about the probable course of an illness. The biopsychosocial approach, when we're talking about abnormal behaviors, then we mean that we're going to look at a biological approach, the psychological influences, and then also social influences. Each of the perspectives has different explanations for disorders. Psychoanalytic perspective says that it's mainly the result of unresolved childhood conflicts. Behavioral says that you have learned this abnormal behavior and that something is reinforcing it. Cognitive, it has to do with your thoughts and beliefs are the root of the problem, and the only way to fix the behavior is to change your thoughts and beliefs. Humanistic says that you're responsible for your own behavior, even abnormal behavior, and you can work on that. And then sociocultural says that abnormal behavior is shaped by society. We use the DSM-5 to classify psychological disorders. Before the DSM-5, people were often just classified as neurotic and psychotic. The Rosenhan experiment, pretty famous and often shows up on the AP test, also known as the Thud Experiment, because the patients claimed that they kept hearing the word thud, or that they felt empty and hollow inside. So there were 8 pseudo patients who faked their way into a mental hospital. Most of them were diagnosed as schizophrenic. Once they got into the hospital, they behaved normally, but nobody ever was suspicious that they weren't patients. There were other patients who were suspicious, but the people who worked there never figured out that they weren't actually sick. So it showed that it was clear that they could not distinguish the sane from the insane in the psychiatric hospitals at that time. The term insanity, generally it means that the person cannot make decisions about themselves, that they were out of control due to a mental illness. It's a legal term. OCD, unwanted thoughts are the obsessions, and then the senseless rituals are the compulsion. So if it's talking about a thought, it's an obsession. If it's an action, that's the compulsion. That's a type of anxiety disorder. Other types of OCD disorders: body dysmorphic disorder, hoarding, trichotillomania, which is where they pull their hair out, and excoriation, where they pick at their skin. PTSD is a type of anxiety disorder following trauma. The hallmark symptoms are flashbacks and anxiety and sleep problems. Causes of the anxiety disorders, learning theorists say that fear conditioning. Also, OCD is linked to problems in, and we didn't even talk about this part of the brain, I'll skip that part. But a big one is problems with GABA. Remember that GABA's job is to calm down the nervous system, so there's not enough GABA calming down the minds of these people. Let's see, dissociative disorders. So dissociation is when people separate from reality. The first one was dissociative identity disorder, which we called multiple personality disorder. There are many psychiatrists who disagree that that's not an actual disorder. Dissociative amnesia is what Freud would have called repression, but memory loss with no biological explanation. And then dissociative fugue, which is very rare, where they have the dissociative amnesia and they kind of wander off and establish a new identity. Of all the dissociative disorders, generally clinicians say the root cause is severe trauma and abuse during childhood, so their mind is separating from reality. Somatic symptom disorder. This is where people have physical symptoms that suggest that there's a physical disorder, but there's no actual physical cause. So it's kind of like having a stress migraine. Like there's not something in the body that causes it, but it's outside environmental things that are causing it. Conversion disorder is a type of somatic disorder. This is where they convert their stress and anxiety into some kind of physical ailment. Sometimes it shows up as glove anesthesia, where they like can't feel their hand. Sometimes it's even blindness or epilepsy or paralysis. But they it's unconscious, but they can't control it. Illness anxiety disorder is what used to be called hypochondriasis, where people think they over exaggerate any bodily symptom into thinking it's a major disorder. Like they have a new mark on their skin and they think that they have skin cancer. Personality disorders, there's a bunch of them, but the key thing is that they have these inflexible, long-standing, maladaptive ways of dealing with others, that they can't establish meaningful relationships. Paranoid disorder, they're basically very mistrusting and suspicious of others. Often they're jealous in their relationships with others. It's not working. All right, I'll be done soon. Schizoid is where they don't have relationships with others and they don't want them. They're very indifferent to having social relationships, very limited range of emotional expressions. Schizotypal, we talked about as a mild type of schizophrenia. Just make sure you send it to me as a PDF then, and I can do them. Sorry. Okay. Borderline, we talked about, is kind of like a mild version of bipolar disorder, extremely moody, tends to have impulsive actions. Histrionic is very attention seeking. Narcissistic has exaggerated feelings of self-importance. Can somebody get the door, please? Let's see. Antisocial personality disorder. This is not the same as people who just don't want to socialize with others. This is different. The personality disorder says they have a disregard and violation of other people's rights, shallow emotions, they lack a conscience, and they're repeatedly deceitful in their relationships to others. Let's see, other versions of it: conduct disorder and oppositional defiant disorder are generally what we would call people who have antisocial personality disorder and they're under 18. The avoidant personality disorders, these are people who are very socially withdrawn in spite of a desire to be accepted by others. So like painfully shy, but they wish they could be around others. Dependent personality disorder, they are very clingy and unable to be alone. They need constant reassurance. OCPD, very preoccupied with orderliness and perfectionism. Major depressive disorder, I don't think I'm really going to talk about, short on time, and I think you guys know what depression is. Let's see. Bipolar disorder, remember, it goes back and forth between depressive and manic symptoms. Manic is feelings of elated, desire for action, hyperactive, and remember, it becomes a problem because it becomes dysfunctional and irresponsible. Let's see, what else? Neurodevelopmental disorders. Those are ones that usually occur during infancy and childhood, adolescence. Autism fits there. Autism usually has problems in communication interaction and then restrictive and repetitive behaviors. ADHD is also considered a developmental disorder. Schizophrenia, severe disorder that involves disordered thoughts. So that's one of the key things, is their scattered thoughts and the psychotic symptoms. That's where they're losing touch with reality with things like hallucinations and delusions. Statistically, about 1 in 100 in the population, but it goes up to 1 in 10 if the genetics are in the family. And it usually shows up in adults starting around the late teens and early adulthood. Key symptoms: delusions, hallucinations, inappropriate emotions. Positive symptoms are when they're adding behaviors in excess of normal behaviors, so delusions, hallucinations, and word salad. Delusions of persecution, that's a big part of it, feeling the paranoia, and delusions of grandeur, or thinking that they are Superman, or often they think they're prophets of God, or that they have some kind of special purpose. Hallucinations can take all forms, but most often they're auditory. Speech is disorganized. Negative symptoms is when they don't have normal behaviors, like they don't speak at all, or they can't show emotions. Catatonic, they're immobile, or sometimes they have this waxy flexibility where they hold strange positions and have awkward movements. Causes, the dopamine hypothesis says that there is overactivity at dopamine receptors, so too much dopamine. A side effect are the enlarged ventricles filled with fluid. Possible other causes, prenatal problems, the mother having an infection during pregnancy, and the diathesis stress model says that people may have the genes for it, but if they don't have the environmental stressors, the disorder might never show up. Let's see. Getting into treatment, counter conditioning, exposure therapy is a way to get rid of phobias where the person confronts or is exposed to whatever it is that they fear. They may do that with systematic desensitization, where they are facing gradually increasing anxiety triggering stimuli. Joseph Wolpe called this an anxiety stimulus hierarchy. Like, first you think about a spider, then you look at a photo of a spider. Eventually, you get to the point where you can have a spider crawling up your arm. So you're being exposed to it, but at each level, you're also practicing relaxation techniques. The doctor is there to help keep you calm. Counter conditioning with aversion therapy, you're trying to pair the behavior that you want to get rid of with something you dislike. ABA, applied behavior analysis, is behavior modification using rewards and punishments. This is often used with autism. A token economy is when you're giving people rewards for some sort of privilege. In prison, they may do this as like extra free time or extra time to watch TV in order to reward good behaviors. Cognitive therapy involves changing the way people think and their self-talk, often used for depression, changing people's false cognitions like I can never be happy into something that thinking they could be happy. Let's see. Antipsychotic drugs. Thorazine is the most well known. It helps to block dopamine receptors, but the side effect is tardive dyskinesia, which includes tremors. Lithium is the primary drug used for bipolar disorder, helps to prevent the mania. Antidepressants, also used for anxiety. The main ones are SSRIs, which help to increase serotonin levels. Anti-anxiety drugs like Valium and Xanax are trying to calm down the central nervous system, often by increasing GABA levels. ECT, electroconvulsive therapy, or shock therapy, is still used today to treat severe depression that's not responsive to medication. Lobotomies are rarely used today. And that's it for clinical psych. Yay, that was fairly quick.